It's unusual that we use the church channel for anything except propagating the Word of God. But so many of you have been asking questions to the pastoral team from within the church about vaccinations, our response to the COVID, sending children to school, usual COVID behavior when we reopen the church. So I thought it's best, because these are not really spiritual questions, these are medical questions. And I thought it's better to have a medical professional answer that for us. And a variety of doctors in our church, and we thank God for all of them. But Dr. Emmanuel and I were talking the other day, and I felt in my heart that it would be good if he could answer these questions. Dr. Emmanuel works with the very famed Dr. Devi Shetty and is the CEO of all the hospitals of Dr. Devi Shetty, about 36 medical centers across a variety of countries, with about over 3,500 doctors working under his leadership. And Dr. Emmanuel is a very faithful, committed with his family, a wonderful family in the church. And he was gracious enough to give us his time out of his, as you can imagine, a loaded schedule that he has in his secular life. But so join along in this video, which we're going to make it into 2 or 3 parts. Now, welcome to the first interview that I have ever done, and it's with Dr. Emmanuel, and it's the topic COVID. In the fourth segment, one of the questions that looks a little complicated is, does the virus get to recognize the host age group? So, is the virus able to identify the age, identify... the question's background is because we hear that the first time it was more about people above 65 years of age. The second time it was about almost everybody except the kids. Now they're saying the third wave, the kids need to be careful. So it's in that background, the question is it like the variants of the COVID are able to get an idea of the domicile of the person, how old is the person, what is the person's physical condition, what are the things these variants of COVID are able to understand? Does it really happen like that?
No, it doesn't really happen like that, because the virus just gets into the host and enters the cells and finds the right receptors to enter in and replicate and make copies of itself. That's it. The only reason why we saw first wave more elderly people, it's not that they got hospitalized more, because the other age groups were mainly mildly symptomatic or asymptomatic, and they could have been handled in a home environment. The second wave, because of vaccinations and the people getting natural immunity because they would have got the disease, we've seen the people in a younger age group coming into the picture, because they were vulnerable and they were some of the people who did a lot of outdoor activities and this one. So it's all about getting severe sickness in the vulnerable people who have a lot of, and elderly people generally have all the other medical conditions which make them prone to have a little bit of a moderate or a severe sickness, like hypertension, diabetes, and other ailments which they all have. But in this second wave, we've seen, irrespective of whether you had some medical condition or not, it's very difficult to predict who and how they've been affected. So that's been very, very difficult.
The imagery that the third wave is somehow designed by accident or by choice for attacking kids is probably an exaggerated.
Yeah, the reason, I think it just says that because a larger proportion of the adults have, some of them have had the disease or they've been vaccinated. So when you look at the vulnerable population, will be who have had neither in
Right.
all age groups, which includes the kids. And kids, we've not been able to really see how many of them actually had the disease, and they've not been vaccinated. So all of them are the vulnerable age group. So when they get affected or in more or less in the same probability or ratios, you will see a larger proportion of kids getting affected compared to that, because there is some level of immunity in the elderly and in the middle age groups. That is what it is.
When will this pandemic end from the medical point of view? So is it what you already said as vaccination, when vaccination is complete, or is there any other way of understanding this?
When the pandemic will come to an end, will be a stage will come when the vulnerable population will be very less compared to the ones who have either the natural immunity because of the disease or to vaccination. Then you will not see any rise in the number of new infections, and it will plateau, and over a period of time it will reduce. Whether this is going to take a couple of years or whether it's going to take a year or how it is, it's very difficult to predict with that. But if you look at the last pandemic, the Spanish pandemic, the flu, it took quite a couple of years in that kind of a time, and that also happened at a time when the mobility was not that great, But here, so right now it's an interconnected world, and this one. So, but the science has improved a lot, and I am sure. Hopefully, I think we should be in at least a controlled state maybe in a year's time or so.
Wow. So this is now taking the question to geopolitics, not really medicine. In fact, you've been very kind. I've asked you questions which really are not under your domain, but questions of governance and questions of education. But thank you for giving it from the medical perspective. This is again a question on world wars and stuff like that. But from the medical point of view, should we believe that this pandemic is really the result of a biochemical war or a world war initiated from China? The question says, please give your honest opinion from the medical point of view.
Definitely, this is a zoonotic spread. That means it spreads from animal to human beings. Some bats, there's an intermediate host. So this is not the first coronavirus which has led to a serious infection like this. There was already a SARS one around in 2000, early 2000s. There was already one like that. There was something called the MERS, the Middle Eastern Respiratory Syndrome. So there has been a lot of this one. So right now, they are in the process of finding how it has spread from bats to an intermediary host, and to that. It's taking a little bit of a longer time. But that is one of the things. So there are a lot of speculations in the media, there are a lot of videos on YouTube and other things. Whether it is world war, and I think that's stretching the imagination a bit too far. I don't think anybody would want to do something like this and create so much of destructions and so much of causing this one. There has been videos and speculations that probably some experiment having gone wrong and it's escaping from a lab. I'm sure there has been some work going on around in that, whether that really was the case or not. And also there's a lot of talks about whether some kind of a research not properly regulated and not going in the right directions, and this is very difficult to know about it. But I think a lot of countries do work on something like that, but these are all beyond the public domain. We really don't know whether something really exists or whether we need to believe some of these reports, odd reports come out, to what extent this is true and things like that. It is a little difficult to know. But there is knowing whether science has progressed to something like that, I think the rapidity with which technology and science is moving fast, we cannot say that we cannot this one. So, but whether this was really because of that, I cannot. I don't think so, because I don't think that is there, because there has been series of similar kind of diseases in the past, so which is affected. Only thing is, all of the previous, the SARS viruses and all that, it never transmitted so rapidly. The transmissibility of the virus wasn't so high. So when somebody got the SARS one, the disease, they were so sick. They generally, came out of it or they died. So it was easy to isolate those people. But now the problem is, because you can be asymptomatic, you can be mildly symptomatic, and mildly symptomatic people can ignore all these things, even though don't get tested, and pretend, or think that it's all right and move around and continuously keep spreading that. I think that behavior is possible here now in SARS 2, COVID 2, and that because of that, I think it's spreading a lot because of that, and that is why it has moved to that extent.
Coming to a very sensitive question. A French Nobel laureate, whoever asked me this question, whoever passed on this question, you've asked the right question, but this question has kept my house, discussion alive for at least a few days between me, my wife, and my children. So today, I'm glad I can ask you that question. A French Nobel laureate has reported that people who take this vaccine will have deterioration of health after 2 years and breakdown of immune system. Somewhere it was also given the effect that in 2 years they'll die after vaccination. Whoever this French Nobel laureate is, but it came out in the media. Is this true? What is its reality?
Yeah, science can have differing viewpoints, and you can have many papers for a particular a form of theory or science, and then you can have multiple papers arguing against that theory. So these things keep on happening in that. So this is one. You can even say it is an isolated viewpoint of somebody, of a person of a very immense stature who in science. He has a viewpoint, but that has not been that evidence which he has been advocating. I have not read about anybody strongly coming and saying that what he's saying is absolutely true, and things like that. So there are different viewpoints in science for anything in medical science. When you start looking at it, a lot of people will get confused when you say that you will have 10 different papers saying that this kind of treatment definitely works, and you'll have 5 papers saying that maybe it will work, and then 2 papers will say it definitely doesn't work. So, but then how do you interpret it? So that itself is a different way of looking at it. There is a different evidence-based medicine as to what it is called. So there are a lot of ways of looking at it as to how it is studied, what is the sample size, how does it benefit, all those kinds of things is there. So so he's got a very strong point of view. I have not read across something which to say whether it's true, not true, whatever it is. His main contention was, why are we vaccinating during a pandemic? That was his main contention about the whole thing. He's saying that we should not be vaccinating during a pandemic, but the fact is thousands and thousands of people are dying.
Yes.
So that is the main this one. So it's a different viewpoint. So the fact is, like I said in the beginning, millions and millions of people have had the vaccine, and you can see all around the world they are trying to come back to a new normal, at least with little more caution, and it's very difficult in a interconnected world as it is now to stay locked up. This one, there has to be some balance, and when we do that, I think the benefits of vaccine far outweigh the risks for that. And I think one report which has been coming in here I think should not increase our anxiety and lead us towards hesitancy. That is very important for that. Yeah, ultimately, I think we need to trust in God, and because this exaggerated fear, I think, can cripple us in this environment. I think
really is. And in fact, Dr. Emmanuel, God willing, we're going to do one more segment on mental health care. HOD Nimhan's Dr. John is going to be coming. It's the first time in my life I'm doing all these things. I've just preached the Bible, but the society has developed so many needs because of wrong information's going. And I thought, why not use a God-given platform for something that will benefit the community and anybody, in fact, not just a Christian, but anybody. So do share these things with others. I guess the last section, we have come to
because
the last section.
I think a lot of people have these hesitancies because they don't see the other side of the severity of the illness, which people in the hospitals, working healthcare workers in the hospitals get to see. Either they see this as a mildly symptomatic or a asymptomatic illness, or they feel that some elderly person has passed away, he had other problems as well, kind of a issue, and they've not seen that. The second wave was the one I've spoken to so many people in Delhi, Mumbai. Every household knew somebody who either had very severe illness or somebody had lost their lives. And if you look at our hospitals, across all the major hospitals, wherever it is, I think some of our healthcare workers have declared people dead in a short span of around 6 to 8 weeks, what they would have done probably in 1.5 to 2 decades. And they've seen people and the helplessness with which people were there in those situations. One is you had such a large number of people seeking treatment when we were that kind of nobody was geared up for that. And a lot of people died because they couldn't get into at an appropriate time. And people might have had symptoms, they might have thought, oh, it's just a small one and it doesn't matter, and then they don't get in touch with an appropriate. Now, you can do a video consulting. You have to be under a monitoring or by somebody to know, no, now this is not the time to stay at home. You need to come to a hospital. A lot of people came at a very late stage, and that is something which went against them, and that is one of the reasons why some of them lost their lives because of that, or had a very crippling kind of illness. So from what we have seen of the severity of it, and also people are not able to experience, apart from you have a loved one in a hospital, you're not able to experience what they're actually going through, because unlike other diseases, you don't go and visit them also during a hospital. Yeah. So they don't get to see, but the suffering which they go through, which our healthcare workers see. So that from that angle, if you start looking at it, and if people look at it as, okay, this involves such severity and such, and you can lose your life, and it's not one thing like, it's a sudden thing, you struggle your way through kind of a stuff. I think it brings in a lot of this one. I think a lot of people will not be hesitant anymore if they go see that element or that side of it, because they don't get exposed to that element of it. And because healthcare workers, like you said, that you want to do something on mental health, we get a lot of people who are very, very disturbed because our staff, we have a very big health a group which handles that, or a helpline. People can reach out to our psychologists and psychiatrists, because in addition to burnout, physical burnout, I think getting to see something like this affects some of them way, way beyond you can actually imagine.
Last segment. As the government is relaxing the lockdown restrictions, what are the best practices to keep in mind in the context of the following? One, Sunday services and other events like weddings, dedications, which happens in this church hall. For worship on wheels, which is happening in the ground. Now the government has not given any age-related restrictions and said all age groups can come. Many of you elderly people got angry with me because last time it was announced that above 65 and below 10 should avoid coming. See, that is not my rule. That is government rule, which I communicated. I want you to come, but I cannot violate the government rule. It is not my rule. Anyway, this time there is no such rule. All can come is what the government has told. So I am saying, come, all come. In fact, that scripture is there in the book of Revelation, chapter 21, 22, saying, the bride says come, spirit says come. Now pastor is saying come, okay? Because there is no restriction from the government. But the question is, the question really is it like only vaccinated people should come? Can all come? Is it dangerous? Already we have some protocols. Dr. Emmanuel, you would have already seen, we test the temperature, we fumigate the place, or I forget the right word.
Fogging.
Yeah, we do the fogging, and the volunteers are so kind. They all take time to. In fact, people who come without mask. Last time we started giving free masks, saying, okay, from the church, you just wear it when you're in the church, just to honor the public decorum, stuff like that. So, do you feel we need to do anything more, or you think these are just?
I think the church has been, very, very responsible and had followed all the advisories of the government. I think it's been remarkable from day one. And I'm sure you're going to follow all the precautions and the advisories. So the WOW service, I think there is nothing to be done because it's an open air kind of a thing, and people stay within the, the close confinement of their own cars, and I think that should be fine. The question about weddings, I think we need to follow that kind of precautions. There is no other this one. This Sunday's services split this into the main sanctuary and the overflow, whether you want to create, because overflow is quite open, and even if people have not been vaccinated or the vulnerable can be there, but here I think it can be a little more relaxed. Kind of this one, because anyway you are having a safe distance and other things, people are going to wear masks and things like that. But from whatever lessons we learned in the initial part of the wave, all about singing and all those kinds of things with churches where all got affected and other things were all there. So I'm sure, we're not going to get this jam-packed. So I think that that's so when we are following all the precautions, I think what we are doing should be fine with whatever we are doing.
Thank you so very much.
Thank you, Pastor, for having me here.
It was so nice talking. Yeah. We've taken a long time to ask questions, and you've taken your time to answer. So thank you for taking your time, and looking forward to days where we will not have to have these discussions.
I know. A much simpler world.